So welcome everybody today. So this is the CT2I Festival of Health and Social Care, and this is the hospital to home demonstration. So hopefully you were in the sessions earlier and enjoyed the panel discussion, and saw the 15-minute presentation that I made earlier introducing hospital to home and sort of where it's come about, what the system is, some of the benefits and things like that. So we'll explore some of those themes in a little bit more detail today, but certainly as well, and we'll get into the demonstration of the system and show you what that looks like. As well. So my name's Stephen Girling and I'm from Tech and Care and I'm the product owner. There's some links on the screen as you can see there. So there's a hospital to home website. Certainly encourage you to visit the website, to explore that, to see what's on there around more information around the product and the business case and news as well. There's plenty of news stories on there. So yeah, it's a good place to visit. And also we are on Twitter as well. So we have a Twitter handle, Hospital to Home One, and certainly encourage you to follow that as well. So as we post blog posts and updates regarding the system on the website, then we'll also promote that via the Twitter account. So good way of staying up to date with what's happening with Hospital to Home is following us on Twitter. So do please feel free to do that. And one of the first things, though, that we wanted to do before we get into the demo, just to warm things up, I suppose, and just to kind of get us into the flow of some of the polling that we're going to do, is to kick things off with a bit of a different poll to begin with, just something that's not quite, you'll see, not quite linked hospital to home, but just to kind of get us into that flow of responding to the polls. So the first one, Irene, I think is going to make available now. So yeah, the first one that's up, not related to hospital to home, as I say, but just to warm us up to the polling and getting interactive and things like that. The question that I'm posing to you is, are you watching Strictly Come Dancing at the moment? So nip over to the polls in the chat function there, and yeah, give us an answer on there. We'll get going with the demo and hospital to home, what you're here to see, but just to break the ice a little bit with us and get into the role, like I say, of doing the polls and responding to the questions and things like that. It'd be great to see. Yeah, any Strictly fans out there? Anyone? John, I don't know if you mean to share your camera. That's good of you, but you don't need to if you don't want to.
No, it happened automatically.
No worries, no problem.
There we go.
Thank you, John. No worries. So yeah, I say there's a few more people that have joined as well. So I'll just go over that introduction again. My name's Stephen Curling and I'm the product owner for Tech and Care. So we're going to get going with the demo, and we've got some different polls specific to the D2A process and hospital to home. But just to kick things off, yeah, it's just a bit of a fun one out there to begin with on Strictly Come Dancing. Anybody watching it, any fans of that show at the moment, do feel free to pop over to the polls and let us know. Okay, so we've got 3 votes, and it's pretty even split at the moment. So we've got a yes, no, we've got 1,000,000% yes. We've got a super fan in the room, we've got a fan, and then more people saying no. Okay, fair enough. Not so many Strictly fans in the room. No problem. Well, we won't dwell on that. We won't make that the main topic of conversation for today. But thank you for answering that poll. That's good to see. So not too many fans, 1 fan, and then yeah, maybe a super fan in the room. Okay, thank you for that. Just a little bit of fun to start off with there. So the first main poll, though, that we're going to do that is related to the discharge to assess process and to hospital to home, and we're going to make that one live now. And it's just to kind of get a sense of where you think the numbers are. So it may be that you're involved with D2A and with D2A in your locality, if a local authority or your acute trust or hospital. So if you are, then have a look at the poll. If you're not, take a guess at what you think the answer might be, and just with those numbers that's in the poll, it'll just help frame the demonstration when we get in there, because you'll be able to then imagine those numbers in the system, moving through the system on a daily basis. So I think the poll's been made live now, so it asks the question on a daily basis: how many active discharges do councils manage? So it's on a sort of average that we've worked out from the project that ran last year. So have a look and see if you can see what you think. Say if you're involved in it. So one person 10 to 150 to 5,000. Just give you a minute or two, just have a look at that. Less than just a couple of seconds, and we'll see what the consensus is on what we think. How many active discharges do councils manage on a daily basis, do we think? 3 votes, yep. couple of people for 10 to 150, evened out now, 150 to 5,000. Okay, let's see. Okay, well, do please feel free to comment as well in the chat box as well if this is your experience on the numbers that you have. So the answer that we have that we've kind of gone with and on our website that say was informed by the 5 local authorities that all co-funded and were part of that cooperative that came together to develop hospital to home was between 10 and 150, although could easily be just over 150, in which case it would slip into the 150 to 5,000 category in the poll. So understandable if people went for 150 to 5,000, but on average, the numbers that we tend to keep in mind through hospital to home is that on a daily basis, councils are managing 10 to 150 D2As or discharges on a daily basis. So that's a number to keep in mind as we look at the system and sort of visualize that those numbers passing through and how that would look in the dashboards and things that we look at. So thank you very much for contributing to those polls there. I appreciate you diving in and answering those. That's really, really useful. This is what I talked about earlier, so I'm not going to spend forever on this, but just to reiterate again, if people aren't familiar with hospital to home, what we're going to be looking at. So we're looking at a system that is aiming to remove that discharge to assess complexity and to ensure patient safety and improve D2A management. So hopefully that's what you'll see from the demonstration, that's what this system, that's what this solution is looking to deliver to local authorities and to health providers and to acute trusts, is really cutting out that administrative burden that exists at the moment around D2A and getting patients through that process more quickly out of hospital, so they're not having to stay in hospital longer than they need to. And the quote there, again, I won't repeat the quote because we went through it this morning, but just so you have that there from Wendy about what hospital to home does and what it's seeking to do. So without further ado, we're going to get into the demonstration of the system. As we go through, please feel free to post questions in the chat box, and then as I come to the end of the demonstration, we'll then go through some of those questions, and then there's a few other things that we can talk about as well after that around the business case and around what we can do to support you with the business case and pulling that together if hospital to home is something that you're interested in. So there's various things that we can do to help you through that process. Okay, so this is hospital to home. So the way it's been designed is with the user, it's a user-centric approach, and really wanting to make this first page. So this is your dashboard page. This is the first page that you come to when you log into the system. Make this as simplistic and easy to understand as possible, so that it gives you this overview in a snapshot straight away. It's live and it's up to date of the numbers of discharges that are moving through this hospital to home product on a daily basis. So you can see here there's various different widgets and various different views of what's happening. So we've got upcoming EDD. So this is based on the estimated discharge date and then broken down by pathway as well. So we can see what's happening today, tomorrow, and up to a week in advance. And these are the people that are on either pathways 1, 2, 3, or end of life. I'll show you how we record that in the system, but you can come in here. So at the moment, this would be something, if you're in the discharge hub, for example, if that's where you work, this is the type of thing that you'd be seeing when you come into your dashboard. So you can see what's happening on a daily, what's happening today and what's coming up. So you can also see as well if there's any delays in the system. So if you've got any discharges and they're delayed based on their estimated discharge date, so if it's been a day, if it's 1 or 2 days or 3 or more days, then you get that instant view there as well. So who are the delays? Who are the people perhaps we need to prioritize or at least be aware of exactly what's going on with them to understand why that delay is happening. There's then some further widgets here, which were designed by the co-fund councils and the subject matter experts that we worked with on that development. So this is what they said would be the most vital information to see on the dashboard when you come in. If, as I say, you're a case manager in the discharge hub, as this view is here. So not allocated to a case manager. I'll show you what that looks like, show you what it looks like when we've got a discharge that hasn't got a case manager, how that shows up as a flag here on the dashboard. Active cases that have not recently been updated. So if there's a case that's not been updated for 48 hours, it'll flag here as well. Prompt that question, why has that not been updated? Maybe we need to be doing something with that. does not meet the criteria to reside. So if a person doesn't meet the criteria to reside, then that will show here at the destination awaiting final assessment, so we can see, sort of getting a picture of where they are on the journey between being discharged to being at home and having that assessment made, and then awaiting that final assessment. If they've been at home and awaiting that final assessment, it's been over a day, then it'll flag here as well. So these are just some of the key indicators that are on your dashboard here. And as I say, when I go in and show you how to register a discharge, we'll have a look and see what that looks like. All of them would be clickable as well. I'll show you that. But once there are numbers in there, you can click into them and it'll give you the list of the people. And then as a case manager, what you would see here is a current caseload. So if you have people assigned to you, if you're assigned to their record, then or their case, then you can see a snapshot of your current caseload. And then also anybody who's awaiting a pathway decision assessment, they will display here. And I'll show you what that looks like as well. So this is the dashboard view. It changes as well depending on who you are. So it is designed very much around role-based access control. So depending on who you are, what team you're in, it may be that you don't need to see all of this, and I'll show you that as well as we go through. But as an example, if you're in a transport team, then you might not need to see all these upcomings, the delays, all these widgets. All you're really interested in is who you need to be, who's on your caseload. So who are you needing to arrange transport for today and possibly for tomorrow. So I'll show you that view and what that looks like for somebody else as well. So, and this is all configurable by your administration team. It's all based on what role you have in the system, and it depends on what you can see. Also depends on what you can do as well. So it can be restricted right the way down, so that all you could do is view a case rather than actually edit it, all the way up to, let's say, full administration control, where you are in control of everything that's happening in the system. But all of that can be controlled and configured by your organization as part of the system administration. Okay, so that's the dashboard. What we're going to do now is we're going to register a new discharge, and we'll start to follow somebody through this journey. Okay. So we need to use an NHS number. It needs to be a valid NHS number, and it will validate that. So I'm just going to get one here that we can use for test and save it. That will also perform a check at that point as well. So if a person has already been entered into the hospital to home system and they already have a case, then based on that NHS number, that will pull them up, and then you can continue to build their record within this system, rather than it being a new one all the time and then having duplicate records for a person. They should only ever have one record, and then the different times they go through that discharge to assess process will be recorded in here, and that's based on their NHS number. But this one is new to the system, so we can go ahead and give them a name. So last night I was watching Parks and Recreation, so I think we'll put Ron Swanson in here today. Any fans, feel free to message, let you know. But yeah, we're going to create Ron Swanson here. So that's our person. That's our person who's been discharged from hospital. So Ron is the person that we want to get home, and we want to get assessed and move through the process. And I'll show you how that works now in hospital to home. So we can enter Ron's date of birth. So let's say it is that. And what you'll see here with the yellow fields, these are the mandatory fields. So these are the ones that we have to enter data for. And you'll see that there are only 5 of them. There are only 5. So this is designed to only have the minimal amount of data that we need for a person to be entered into the system. It doesn't replicate the patient record in your electronic patient record in the hospital, and it doesn't look to replicate records that you might have in adult social care systems. This sits in between those, and it's the gap that was identified as existing. So real conscious effort has been made to ensure that the data that's entered into here, as it relates to a person, is the minimum amount of data that is needed in order to manage this discharge to assess process. So that's why we just have the 5 mandatories. There is also the option to enter a postcode. So if the person entering this new discharge knows the postcode, they can do it. Or if they know that this person doesn't have a fixed abode, then that can be ticked here as well. But in terms of the mandatories, it's just these 5. And then we're going to enter their expected discharge date. So let's say that is today. And their discharge origin. So this is where they are physically right now. So in this system that I'm showing you, there's just these 3 options or other What you would see if you had this product is that would be completely specific to your locality. So your hospitals would be listed in there with the right names of the wards sitting underneath them, so that you could select where they are right now in the hospital. Because this is a demonstration, we've just got it quite generic as ward 4, 5, and 6. So I'm going to pick ward number 4. So this step of registering a new discharge, in terms of the process and in terms of the handoff between the different teams, what we see as best practice is this being done within the hospital, and that's all that needs to be done in order for a discharge to be registered into the system by the hospital. It's just these fields here, and then it will then get picked up by the discharge team. So this is what we're looking at in terms of what's required in order to register a new discharge. It's just these data fields here, and then we can save it. Okay, and so now what we're starting to do is we're starting to build up Ron's record. So Ron has been identified, has been going into the D2A process. He's now had his record created, and he's now in the hospital to home system. We've got some minimal data around Ron. So we've got his name and date of birth, NHS number, didn't know his postcode, and we know that he's awaiting a pathway decision assessment, being discharged from ward 4, but we don't know where to yet. But we know the expected discharge date is going to be today. At the moment, we don't have a pathway, case manager, associated team. So we've just got the base data that we need for Ron to be entered into the system. But you can see we're starting to build up an activity record. And so everything's time stamped and date stamped within hospital to home. I'll talk more about that audit log and what that looks like and where that and the thinking that's gone into that as well a little bit later on. But we are always building up a record of everything that happens with the case within hospital to home. And so if I flick now back to the dashboard view here, what we'll see is that Ron now has appeared on our dashboard. So as a member of the discharge team, we can now see there's a flag because we've got a discharge that's been registered that doesn't have a case manager. So that's the first flag here. So that's what this looks like. And if I was to click on this, like I say, it'll then tell us who that is, and we know that's Ron because we've just entered him. But also listed here is awaiting a pathway decision assessment. So he's brand new into the system, and needs some attention from the team. So as the team gather around during those stand-ups or whatever it is and look at each person and what needs to happen, they can then pick up the discharge that's registered into the system. So we're going to go back to Ron now, and we're going to start to then manage Ron through this, get him home, get him assessed in that home environment. So it's got to be the expected discharge date. Then we've got the status. So what we've got here then are a number of statuses, and this is really the journey that Ron is going to go through hospital to home, from where he is now in the ward to being at home and being assessed. And these first 6 here are the key statuses that he's going to go through. So at the moment at the top, then we're going to get into discharge planning, awaiting discharge, discharged, awaiting assessment, and then assessed at home. If at any point this case needs to be abandoned, then it can be. There's an option for that. Might be an example, something sadly someone passed away as part of in the middle of the process, and then this was abandoned, that could be recorded. Or indeed, if it's entered in error, if they thought they were going to be on a pathway 1, 2, or 3, and actually they end up on pathway 0, which isn't recorded in the system, then it could be down as entered in error. There's a specific process that is followed for deleting a record, which I'll show you as well a little bit later on. But that's a very robust and thorough process that goes through. So if a record is going to be deleted, then there's very specific steps that need to be taken. If it is a genuine record and we're working through being discharged to being assessed, then the record will stay within hospital to home for 8 years. So that's as per the NHS guidance on those records. So 8 years it will be in the system. But there are also all kinds of flags to the admin team when you hit that 8-year period to say, okay, you now need to look at these because they've hit that point where they're beyond their retention period. So you should be looking at deleting them. But that's built into the system. But we're going to go back to Ron. So today, been discharged. So the team's now gathering around Ron, and we're going to say, okay, we're going to start planning. So discharge planning is in progress, and Ron's on pathway 1. If he was on a different pathway, we can select that as well here. But for Ron, it's pathway 1. We want to get him home in his home environment, the best place for his recovery. That's where he's going. His discharge origin is ward 4. If that changed, or if that was if it wasn't right the first time it was entered in, or if something wasn't correct, then that could be amended. But he's still the discharge origin is still ward 4. Discharge destination is going to be his own home. So again, we've got these different options here, which all correlate back to which pathway he's on. So for run, he's on pathway number 1, and so he's going to go into his own home. But if it was any of the other options, they can be recorded here. And also, there is also another option as well. So if it wasn't one of these which are pre-defined in the system, you can also select other, and then there's an option to add that in here. But for run, it's his own home. So we know his discharge origin was Ward 4, but his actual current location might have changed. So we have some options here as well. So pre-built into the system are these ones here. So if he's still at his discharge origin, we can select that. If there's a discharge lounge, we can select that, as you can see in transit, discharge destination, or there's an option for other as well. Also, what we can do as part of our configuration when we're setting up the system is we can add in some locations which would sit under other, sort of as a sub menu. So these ones are always fixed and are always going to be here because they're required for your reporting. But in terms of other, then that can be nested with values underneath there, which are specific to your locality. So that is something that will be done as part of the setup of the system with you. But right now, we're going to say that he's currently still in Ward 4 while this planning is going on. We can then assign a case manager and assign a team here as well. But I'm just going to remind you again, just save that as it is. We're going to start to see this picture building up here, some more activity. We're starting to see more information here in our snapshot view of Ron and what's happening with Ron. And just to go back as well to the desktop view here and show you the dashboard, not desktop view, sorry, the dashboard view. Again, just to reiterate these flags and what they look like. So again, not allocated to a case manager, so it's still showing as a flag here. Okay, so we're going to pick up Ron. And I'm going to update the status now. And now we're going to start to assign a case manager. So I'm going to assign myself on there, and then we're going to start to assign Ron to some teams. So the teams that then are interested in Ron and his discharge through to assessment. So we can add the teams in here. Any number of teams can be added. Similarly, any number of case managers can be added as well. So that picture can build up, and then as a team needs to be involved, they can be added. But then when they're when their actions or what they needed to do are completed, then they can be taken off as well. And I'll show you that in just a moment using the transport team as an example. And we can also then add notes onto the case as well as we go through. So at any point they can be added in when we're changing statuses, or that we can just add notes as well. And I'll show you that in just a moment. But let's say it's just going to reiterate what the status is. But let's say planning's in progress here. And we save that. And again, then our picture is building up our activity. So we've got the case note that we added in here. And then we're also seeing that the teams and the caseworkers have been added. We can see the status has changed. So what it was to begin with and what it is now is all going to be captured in this activity. And this is going to build up and build up and build up throughout this process. In terms of adding notes, there is an option. So if we didn't want to update the status or anything like that, we just wanted to add another note in here. So just call this an example note relating to Ron. If that can be happened at any point, and it may be as well that you want to upload a file. That can be done as well at this point. So if there's something that's quite pertinent to Ron that is relevant to his D2A, and you want to upload a file, that can be done here. And all the standard file types, whether it's Word documents, Excel files, JPEGs, PNGs, all that sort of thing, that they can all be accommodated in terms of that file upload. And then when we save that again, then we'll see that added to the activity just here. So thinking now that Ron's moving through this process, so discharge planning was in progress. Now we're going to move through Ron so that he's now awaiting. So he's waiting discharge. That also means as well that his current location is no longer on the ward, so he's awaiting discharge now. So maybe he's been moved to the discharge lounge. So we can update all of that here. We're going to save it. We're going to come back to the dashboard here, and just to show you again now. So the flags have cleared in terms of Ron, so that's good for the time being. And Ron now is in this current caseload. So for me as a caseworker, I've got him listed here in my current caseload, along with some other people as well. And as I say, just to go back to that second poll that we did regarding the numbers of daily discharges that a authority might have, if it is that 10 to 150, even if it's above that as well, edging above that, then you can see how this will kind of really give that clear picture, more so than a spreadsheet scrolling through all those lines of data and columns and rows and keeping it up to date. Give you that snapshot view of 150 people on a particular day, where they're up to, the pathway that they're on, when the date is due, if there are delays, the current caseload, who it's assigned to, and those people that may have been entered and are awaiting that initial pathway decision assessment that we've just worked through there. So thinking about those increased numbers, you can see how this dashboard really does transform the way you get that view of what's happening at any given time on any given day relating to the discharges through to them being assessed. Coming back to Ron. So Ron now is awaiting discharge. But one thing that may happen now is that he's going to be discharged, and we then are going to await some transportation to come through. But at the same time, so he's now been discharged, and so no longer meets the criteria to reside in hospital. And so we have here then a way of recording that information, and it's got the date and it's got the time. The time can be altered as well. So if this, it will go to the default as to what it is now. But if we wanted to change this, and actually it happened earlier, then that can be edited in here as well. So the time that person that Ron didn't meet the criteria to reside, it was captured and timestamped in the system. And if there's a delay reason as well, so he's been discharged, it doesn't meet criteria to reside, but Ron's still in the discharge lounge. So what's going on? Well, we've got this list of reasons here, and this list of reasons here are all what is in the policy that came out regarding discharging community. So the delay reasons that you need to report on are built into the system. And so for Ron, we're going to say, okay, he's awaiting transport, and if there's a secondary reason as well, maybe he's waiting for medicines as well for them to come through. So we can record that on Ron's record just here, and we're going to save that. And we can see here now then on this flag, so it does not meet the criteria to reside, we can see there's one person. So just showing you again how these widgets that are on here as well react to what's happening with our cases as we go through with our people. So with Ron, so coming back here, so Ron's been discharged, he's waiting for that. So we now need to assign another case manager. So we're going to bring in David, and we're going to also add then another team now. So we want to add in the transport team. So Ron's waiting for transport. We've now assigned it to David so he can pick it up. Transport team is listed on here as well, so the transport team can see who they need to be responding to in order to get them home. And so we're going to add them on. If we wanted to add a case note here as well, then we can do. And then what we can say is that he's been discharged, and actually now Ron's on his way home. So we won't update the status just yet here, but what we will do is update his current location. So he's no longer in the discharge lounge, but he's actually in transit. So we're going to save this. So Ron's been picked up by the transport team. He's in transit. And what we could do now is send a team alert. So what we have here is this team alert function. If we open this up, so there's two key points in the journey that have been identified to say that all of those teams that are listed on Ron's record that we just looked at there, they will get an alert to say that Ron has left the hospital. So I can select this and I can send that out. And that'll be a text message alert and an email notification. Email, yeah, will come through, and that'll say Ron has left the hospital. He's on his way home. What you can see as well is that when Ron has arrived home as well, we can then send out another alert as well. So again, just bringing transparency to what's happening with all of these people that have been managed through this process. We can send out these alerts in real time. We can send straight away. Ron's left the hospital, he's on his way home, and then once Ron has arrived home as well, we can send out that alert as well, so that people are being kept up to date all the time on those two key milestones, should we say, within that D2A process. So that's what we could do at this point as well. We could send that out and let everybody know Ron's now left the hospital. Okay. And so then we come back into to Ron's record here, and so we know that now he's with the transport team. So what I'm going to show you next, if we come back to the dashboard here. So as I say, at the moment I am within here as someone who might be in the discharge team needs to see all of this information. But if I'm in the transport team, I might not need to see all of this, and it isn't perhaps appropriate for me to see all of this. So what does that look like then if we are a member of the transport team? So if I just jump over here, what you'll see now. So I'm now impersonating David Greenwood that we added on as the case manager and as part of the transport team, so that now what can David see? So David can't see anything like the same amount of information as we saw before, but what David can see is what he needs to see and what he needs to know about. What he needs to know about is his current caseload. So he's got 2 people, Ron Thompson we put in today, and also somebody else whose estimated discharge date is tomorrow. So can start to look ahead about what's happening in the future. And again, thinking of the numbers as we extrapolate it out, 10 to 150, these lists could be a lot longer. And then we've got the discharges for today. So what does David need to worry about today? Well, it's Ron and getting Ron home. So he can then pick up Ron here and he can come through, and you'll maybe notice subtly here as well that this is slightly different. So activity still adding notes, updating the status and the details, but there was an audit log option here, but Ron, because it's not determined that that David needs to see that isn't available. But what he can do is he can come in and he can update the status. So he can say now that he's at home and he's awaiting assessment. And so you might then also say the current location is at this discharge destination, so he's at his own home. And he might then take himself off. This is all down to how you want to manage the system yourself, but you then might say, okay, we've done our part, we've got Ron home, and he's waiting for assessment. And we can say it was all okay, and something like that. We can take off the flag that it doesn't meet the criteria to reside anymore, and then we can save that. So now if we come back to David's thing, we can now say, okay, so that's gone. So he's done what he needed to do there. Ron sorted from the transport team's perspective, and he's back now waiting to be assessed in his home environment. So you can see then how that view changes depending on who you are, depending on what your role is and what you should be able to see. Go back in here as we were before. So this is the view. So now we've got this flag here to say that someone's at their final destination and they're awaiting the final assessment. And so we know that's Ron. Let's come in. Let's pick up this again. And then for completeness, what we can do is we can come through and we can complete this. So we can bring Ron through to being assessed. We might have more teams that we need to add and more case managers, but let's assume that Ron's at home, the right people are there with him, and Ron's received the assessment that he needed to receive. And we can save that. So that is Ron's journey from being entered in to hospital to home as someone who's going to be discharged from hospital, all the way through then to what happens to them being picked up and assessed at home. A few other things to show you here as well that maybe haven't touched about. So also you can edit a patient's details. So the minimal data set that was entered, if any of that needs to be changed, if any of it's wrong, it can be. And then what I also want to show you here then is the audit log. So only people with appropriate permissions can see the audit log, as you saw exampled when we were in the transport team view. They couldn't see it. But if you do have the appropriate permission to be able to see it, then you can come into this audit log. And the audit log is a really key piece of functionality that was developed. And it was all around information governance and information security and an audit in mind of this. And so it was very, it was an area that the LGA were particularly stressed the importance of that should be given some really considered thought. And so what this audit log provides is all of the activity that happens on a record that's entered. So whether it's edited or whether it's viewed, it will always be recorded. All this is just saying me as it's been me today, but anybody who might come in and view it, it will be recorded, timestamped and date stamped as to when that happened. And certainly any change to the record statuses, discharge destinations, locations, all of that information is captured here in the audit log. You can filter it as well if you wanted to search through something. So if you just wanted to have a quick look and see, actually, I'm just only interested in what's happened regarding status, you could filter it down if you wanted to, do a little bit of a search. And also what you can do is, crucially, then you can also download it. So you can take an extract of that. And the importance of that really came from a use case of a local authority that had to go into legal proceedings regarding a patient who was discharged, the person, and then they raised the complaint, and they had to produce the history really of what happened with that person to say this is what happened at each stage, and they weren't able to do it because of what we talked about before, all of the spreadsheets, the emails, the back and forth, the phone calls, maybe text messages, all that sort of thing. And they couldn't do it. So that's what this audit log is there to do. So if I hope it wasn't, but if there ever was the time when you needed to say, okay, this is everything that's happened with this person as part of their D2A, extract that out, and you've got that evidence there of everything that's happened at what time, who did it, and then you've got notes and the files as well that add to the context of what's been happening. So that's why the audit log was developed there. Also worth saying as well, so we're looking at this at the moment on my laptop screen, but because this is designed for people who are out in the field as part of this process. So if you are on the transport team, or if you're the person doing the assessment at a person's home, you don't need to just have a laptop. As long as you've got access, then you can access to Wi-Fi or your 4G or whatever, you can get into your mobile device and a tablet device as well. So it works. It's been designed to work on phones, tablets, and laptops as well. So you have that flexibility in terms of the D2A process, and also being able to keep it live and up to date and responsive to what's happening in real time. I'm going to come back to the dashboard now. Okay, so that's our journey. That's our journey. That's our runner's journey through hospital to home. So what I will come on to next is some of these things at the top here, so reporting, system administration, and the glossary. But before I do that, I just want to have a quick check to see if there's any questions that have come in. So John, thank you. I can see we've got one here. So is there any management reporting available, number of delayed discharges, number of each pathway users, etc.? Yeah, absolutely. Great question. Thank you for that. And I will show you that in just a moment. So we'll get into the reporting suite in just a moment, and I'll show you that. So yes, there absolutely is, and thank you for that. I was also asked, what does the onboarding process look like? So if you were to move ahead with hospital to home, we certainly hope that you have an interest in it, and then we can be fully supported through that onboarding process. So the way that we tend to do that is that we'll look at putting a workshop in first of all with you. So once all the purchase order and all that's been done, we'll then have a workshop with you, with the people who are familiar with your process, and we'll understand your local landscape, your locality, understand what's going on, who are the organizations that you're working with, and we'll use all that information to seed the system. What we'll then do after that is run a couple of training sessions with you. So we'll do an admin training session and a training session with your users and your super users. That could be all done in one session, depending on the numbers. But we'll do that training with you, and it's a trainer model, which we'll record and make that available to you afterwards. Then you can then go ahead as an organization and start to test the system, start to play around in it. And what also we'd encourage you to do is to build it up. So we'll seed it with the information for your locality, but you can then build it up and make it accurate for yourself. And then once you're happy with that, you've done your training, you've done your testing, and you've built it up in terms of the setup, the back end setup of the system, we can then replicate that setup into your live environment, and then you're ready to go. Any test data we wouldn't copy over, but the setup that we'd support you in getting right, that's what we would do. So thanks for that question, Irene, in terms of the onboarding process. But the key point there is that we will be very engaged with you throughout that. It's not a case of you buy it and you're on your own. We'll be with you basically every step of the way. And me as product owner, will be leading that and be your lead point of contact for that process. Okay, so very quickly, you don't need to dwell on the glossary, but just to let you know that there is a glossary available. So as you're going through hospital to home, if anything doesn't make sense, any of the terminology, then you have a glossary here to refer to. System administration. So I'm not going to spend a huge amount of time on how to set up the system, but the key message here is that we will support you through it. So it relates to that onboarding process. So we'll support you through the system setup, but also that the system setup and the way that the system is administrated is designed to be as straightforward as possible. So there's not huge amounts that you need to get on top of and be constantly maintaining. It's designed to be as user friendly, and again only with the key information that's needed. So the sort of relationships exist. So you have organizations, you have roles, and you have users. So if we look at the organization list, you'll have a council, that'd be a lead council, that's the local authority. And then you'll have all the organizations that are part of the D2A process. So whether that's the hospitals, whether it's CCG perhaps, or a provider, and they can all be created, and they'll all have their own team. So when I was talking earlier around the hub team and around the transport team, we know there could be lots more teams than that. So they can all be created and they can all be added on to the record as and when is appropriate throughout that process. So then what we also have is, my apologies. We also have roles, and so that dictates what people can access. And again, I'm not going to get into the detail of it, but just to show you how it works. If you're an administrator, you would add a role, and then you can just tick what that role should be able to do. So should they be able to view cases, edit, view the audit, delete cases, etc., etc., etc. So it's pretty straightforward for an administrator to be able to manage that and to know what's happening. And then roles are associated with your user and your team. You'll have a limited number of roles. You could have as many teams as you want and as many users as you want indeed as well. And just back to that again, not dwelling too long on this. This is your user list, and you can see then at a snapshot with myself here, name, where I'm from, the team I'm associated to, and then as an administrator, disabling and deleting my account as is appropriate. I will come to reports. So John, don't worry, I've not forgotten your question. That'll be the final thing we'll look at. But just quickly on discharges. So as I say, there is a very robust process to go through for deleting a record when either if it's entered in error or when it reaches that end of the retention period. So you can see here that there's if I click in here, there's someone waiting to be deleted. That would need to have a name that says who's authorized by, and also a file uploaded as well to say, and it's almost like written authorization that they've had permission, the administrator, to delete that record. And then what that looks like here then is it's then recorded in a table. So the actual information relating to the case and to the person, so if it was Ron or Sarah, for example, that's all gone, but it has an ID. It'll tell you if you've exported that information out of the system, how many cases were there related to on that day, who it was done by, time and date, who was authorized by, and then it will also have that authorization file in there and it detail anything else that is relating to an exclusion. But there is a robust process in place for managing records within hospital to home. So what we come to here then is the reporting. And so, John, thank you very much for that question. So there is a reporting suite within hospital to home, and you can do a variety of different things with that. So you can do a report on a snapshot, so that will tell you currently right now what's happening based on the data in the system, or you can report over time as well. So if you wanted to, excuse me, my apologies. If you wanted to report over time as well, so if you wanted to see over a period of months how people move through the system, so we've got delayed discharges per month, so we could see that number of each pathways used. Absolutely. So all of that is within the reporting suite. And during that onboarding phase, when you are doing your training and you're doing your testing, as you add data into the system, we'd invite you, to get properly into the reporting and to have a look through and really to exploit really the data that's in there. Also, what's happening with hospitals home all the time, we're looking at future developments and feature upgrades and things like that. So the reporting, what we're looking to go live with later on in the autumn is giving people the ability to run their own reports. So at the moment, you just run what's in here as preset reports, but you will be given as an administrator, if you have the appropriate permissions, the ability to create reports as well. So that's something that we're looking at the moment, due for deployment later on in autumn. But yeah, say responsive to our customers and what they need and what's useful for them. So we're going to run a snapshot report. How we want to break it down? We can break it down by caseworkers, discharge origin, the top tier that's defined in the system, or if you have origins which you've entered as a locality, they could be in here, or by pathway. So I'm going to break it down by caseworker. And just all I want to see right now is just the number of people on each pathway. So since hospital to home has been in existence, how many cases have we had by pathway, and broken down then also, as I say, by caseworkers. So what this is showing us here for pathway number 1, there were 60 cases and they weren't assigned to a case manager. Hopefully that wouldn't be the case. This is demo, but you have 60 there. And then for myself, Stephen Girling, so I've got 14 here. So pathway 1, I've had 14. Similarly then pathway 2 and pathway 3. So you can see since hospital to home, since an organization has been using hospital to home, these are the numbers, and broken down against the caseworker that's been assigned to it here. What we could, if we reset that, and we're going to do a snapshot similarly again by caseworker, but what we don't want it, since hospital to home has been used since the start. What we want to see is really what's happening right now, so what's active right now. And so the numbers now much less, so it's just the 3 that we were looking at on the dashboard earlier. And so we can see that they are, but it's by the status that they're in. So this isn't the pathway, this is the status, sorry. But we can see that there's 1 with me as a caseworker awaiting discharge, and we can see right now that David's got 1 in this status of discharge planning in progress. I've got 2, and Tracy's just got the 1 there as well. So different ways there's different reports that we can run. Different ways of displaying the data as well. So there's horizontal bars, there's lines, or you can in the group, you can group the data and you can export that as CSV. So if you wanted to just get it grouped, and then you can then do your own representation of that in terms of graphs and how you want to display that data. Also, if you want to extract it as a CSV and then upload it into something like Power BI or something like that, then that option is here. And then there's also the raw data that sits behind that report as well. So yeah, that is also available as a CSV file again if you wanted to put that into a reporting tool such as Power BI. So they're that's an example of some snapshot reports, but over time reports as well. I won't give this one a breakdown, but I just want to see over time the number of people on each pathway. And so really I want to go back to June until now. And we got this in bars here. So over time, so we can see in June there was 6 on P1, July 14 and 1. We can see how that is displayed then for those months, the number of the cases on the different pathways over time. Again, we want to see it by bars, lines. In this case, actually, lines sometimes isn't always the most useful view, but in something like this, I think lines is, because you can kind of see it relative to each other, the different pathways and the numbers based on the months. So that's quite a nice view there. And similarly, again, groups and raw data. So there is a reporting suite that is available, and it has a number of reports in there. And so, as I say, as part of that training and testing, we invite people to properly scrutinize the reporting suite and to really get into it and look at all the different reports and the ways of breaking down the data. So hopefully, John, that gave you a good an insight into the reporting within hospital to home. So that brings us to the end of the demonstration, really. So the question here as well regarding is there anything else that exists in the market? Well, no, there's not. So that's where this really came from. This gap that exists between the EPR in the hospitals, the adult social care systems, and this D2A process just fell into a bit of a black hole between the two. And so no, nothing does exist like this in the market, which really is why the LGA and NHS Digital were so enthusiastic about supporting it with that match funding to the 5 local authorities in order to develop it. Is data held on your servers? It is held on the servers. Yeah, the servers are all in the UK. No data goes outside of the UK. It's all within data centers, within the UK. And just to build on that a little bit more, if you were to move forward with hospital to home and as part of your procurement process, then we can certainly support you throughout that with all of that. And we can help you with your DPIA. We've got a document on the cloud security principles as well. So all of that information relating to security and to cybersecurity and DPIAs, then we can support you through that in terms of the procurement process there. So I hope that was useful in terms of an overview of hospital to home and of the system, and hopefully that brought to life, I'd say, what went into this and the ethos behind the development and why it was so important. Just a couple of things here just to share with you finally, and then I'll come to any final questions. So we've done the demo. So realizing the benefits of hospital to home, this is what we talked about earlier, around the 30% administration reduction. Hopefully that was sort of exampled there. Just while I'm talking about this, actually, Irene, if you wouldn't mind just launching the last poll as well, so that would be really good just for people to have a look and reflect on the demonstration. We'll make that last poll live. So realizing the benefits, the 30%. And what we will do is we'll produce a business case for you. So if you're interested, we'll produce a business case for you. And it's all based on your locality's population size. So you'll see, based on your locality, how these benefits then realize into an actual number for yourself. And that follows our pricing model approach. Our pricing model is all based on the size of your locality. There's a cap as well. So it's not that if you've got a huge locality and someone's got a very small one, that it's just going to become astronomically bigger. We do have a cap on it, which I'm more than happy to talk to you about. And also there's things like discounts. So if you were to go as a locality and then you bring other localities on board, then we recognize that that is the way that the public sector works. You know, I myself came from the public sector before this role. I was in Greater Manchester in the GMCA and a local and traffic council before that. You know, we know that localities do talk to each other and learn from each other in terms of best practice. So various different. So there is a discount that we provide for that. And as I say, the pricing model is all based on the size of your locality, and that's also how we calculate your benefits, which we're happy to do. The roadmaps, what's coming up in the future. So we are looking at the intermediate care opportunity. So we know that this, at the moment, we go from discharge, we go to assess, and that's where this ends. But we are looking at intermediate care and extending this out. So there is an opportunity around that. There's an opportunity for localities to be involved in that and help shape it in the same way that the 5 localities shape this solution. So if you're interested in that intermediate care opportunity, then do please let us know. We're exploring interoperability as well. So the first use case for that is with North Lincolnshire and Good, their EPR system called WebV. And we're doing some work right now on being interoperable with them. That will provide a really good use case. We've done some exploratory work around interoperability as well. So it is something that we are able to do with our APIs. They're open. So that'll be a really good use case for that first example of interoperability with an acute EPR. And continuous improvement of the system functionality relates to what I talked about in terms of reporting earlier. If you need any help making the case, so you might think that this looks great, but you're just not quite ready, you need to do some influencing, we can come in and help you make that case. So we offer a professional services model where we come in and we help you understand what's happening right now. Where do you want to get to? What does good look like? All of those types of things with analysis and mapping and realizing benefits. How are you going to get there? How would you implement a solution such as hospital to home? We can help you make that case. And if you were to take up that professional services offer, that's not contingent at all on then procuring hospital to home. It's a discrete piece of work that we will do for you. Keep all the outputs, but we can support you. So if you do need help making the case, again, that's something that you can reach out and we can help you with. So that brings us then to the end of the presentation. So thank you very much. And if you want to book a demo for your own organization, put the contact there is Irene. So please do make a note of that email address. Also, you're more than happy for you to contact myself as well, Stephen Curling at Tech and Care. I would encourage you to say, go to the website, have a look there, and do follow us on Twitter as well. Going to come back into here just for some final questions. So data held on the service, yep. Afternoon, okay, thank you for that. Question, sorry, my sound wasn't great for a while. Was Karen's question, Karen, is there an integration with other case management systems in use? So there's not at the moment, but as I say, we're doing that piece of work with NLAG at the moment in terms of North Lincolnshire, and we are certainly open to interoperability. But what we've seen with North Links, for example, they've been using this for six months without interoperability and seeing some real huge impacts and some real savings. So even without interoperability, there's such a strong case for hospital to home. That case only gets stronger and the numbers only get better when we have interoperability. Absolutely recognize that, but there is certainly such a strong case to be made without it. But yes, integration with other systems, it is possibly something we've explored as part of the project last year, and it's something that the first use case is with North Lincolnshire that's being worked on at the moment. Last thing then, let's go to the polls. So now that you've seen and heard about hospital to home, yeah, if you wouldn't mind sharing just, which benefit really jumped out to you there. Is there something that maybe something different? Feel free to put it in the chat. But if there are of that list, really, is it that single version of the truth that you think would be the crucial benefit to yourself if you were using the system? Is it around the reduction in administration? cutting out all of the emails and the phone calls and things like that, bed night savings. What is it for yourself really that's jumped out? It's a single version of the truth there is the big one that is coming through. So yeah, I certainly agree with that, and I think that was reiterated with what Marion said earlier in her presentation in the roundtable discussion earlier. So I don't think there's any more questions. So I think all that is left to say. So thank you, Andrew. Thank you for your time as well, and much appreciated you joining. And the details are on the screen there of Irene and myself. So yeah, thank you all very much. Hope you attend the final session, the final discussion that's coming up at 2 o'clock. Yes, and I hope to hear from you all very, very soon. So yeah, no, thank you very much for your time today.